What I am about to tell you may change your life. What I had found out is that nerves could not be regenerated, but they could be restimulated. In that sense, acupuncture stimulates nerves. Electrical stimulation from acupuncture treatment is a lifesaver when it comes to peripheral neuropathy. So if you are suffering from neuropathy caused by high blood sugar levels from type 2 diabetes and experience numbness, tingling, burning sensations, if you get sharp shooting pains that come from nowhere, painful cramps in your fingers, legs, and feet, other symptoms associated with nerve damage could also arise. If you answered yes to any or all of these things, you're probably suffering from nerve damage or nerve degeneration. This crippling condition, often caused by abnormal blood sugar levels, affects several million Americans each year. They cannot do basic activities like shopping, driving, cooking, or cleaning. They feel pain and numbness on a regular basis. Even more frightening, if left untreated, they are in danger of losing a limb. The good news is, you're not alone with this situation. Millions of sufferers have found a solution, and now you can too. This is not just a band-aid or a quick fix for the situation. It targets the underlying root cause of the problem, repairing nerve cells and balancing blood sugar levels. Electrical stimulation from acupuncture will reduce and minimize nerve pain. It will get rid of numbness and tingling. Resume exercise and other basic activities afterwards. Enjoy the freedom and comfort to do what you want. No more sharp pains or cramps. Protect nerve fibers from damage. Enjoy living life again. Now I'll tell you a little bit about how I came about finding acupuncture treatment and electrical stimulation for diabetic neuropathy. I was caring for my mother for many years. After seeing her one day placing her foot down on the ground and not knowing if her foot touched the ground or not, because there was no sensation in her foot, she fell over. This happened numerous times, and I decided to look into it. And that's how I researched it and found acupuncture. Acupuncture stimulation, electrical stimulation, that's the only thing that worked. What happened was I took her to a friend, a medical doctor, who also handled patients with acupuncture. I asked him if he thought that diabetic neuropathy could be helped with electrical stimulation from acupuncture. He wasn't sure. We decided to treat her at that moment by placing her on the table next to that electrical stimulation machine. He proceeded to place the needles in various parts of her hands, her feet, her legs, even around her head. He attached the electrodes and the wires to those acupuncture needles, and the other end he placed in the stimulating machine. He set the timer for 10 to 15 minutes and then decided to leave the room. I stayed there and I watched. I saw that the electrical stimulation was taking effect in her hands and her legs. She was smiling. There was no pain. Everything was fine. Well, about 15 to 20 minutes later, the doctor re-entered the room, took the needles off of her, and she got up on her own and walked out of the doctor's office on her own. Well, when we brought her into the office, I needed help taking her from my car to the door, into the office, and helping her sit down in the waiting room. Well, this was a miraculous development. I was very surprised to see that it worked 100%, and I would take her back every 2 weeks for additional treatments afterwards. Well, how does acupuncture alleviate diabetic neuropathy symptoms? Acupuncture is thought to increase blood flow and thus promote sensation and the healing and regeneration of nerves that have been affected by long-term, uncontrolled glucose levels associated with type 2 diabetes. In addition, it stimulates nerve endings that have been damaged and desensitized by diabetes. This is thought to massage the nerve endings and stimulate increased feeling and sensation in the feet and hands. Well, how is acupuncture performed for diabetic neuropathy? Acupuncture is both an art and science, and much of the procedure will be determined by the specific practitioner that you choose. Usually sessions are more frequent at the beginning, and once healing begins and an improvement is noticed by the patient, the visits to the acupuncturist will become less frequent. Usually for the first few weeks, you will visit the practitioner 2 to 3 times a week, and after that, about 1 time per week. Most people notice an improvement in their symptoms after 1 to 2 sessions, but it can vary, and some people, probably around 20%, report that they do not receive any relief in their symptoms from their acupuncture treatments. This could be because of underlying factors. The acupuncturist will place the needles in the areas where your symptoms are occurring, usually in the hands and feet. The needles are hair-thin, and little to no pain is felt during the insertion, as they are much thinner than the usual intravenous needles, and the pain is not comparable. Additionally, the practitioner may insert needles in the nerves along the pathway to the central nervous system and spine. This depends on the severity of your symptoms and the preferences of your specific acupuncturist. Studies report that in general, about 2/3 of people report that the tingling and burning pain that they experience with diabetic neuropathy is alleviated through treatments. This number is statistically significant and indicates that there is definitely some efficacy to the procedure despite its lack of endorsement from the Western medical practitioners. It is most recommended for people who have not responded sufficiently to standard medications and treatments for the disease. Unfortunately, some sufferers of diabetic neuropathy find little to no relief and thus turn to alternative forms of treatment such as acupuncture. Most patients report that their symptoms are not completely healed through acupuncture, but only alleviated somewhat. So it is not a magic bullet, but definitely has its place as an option for treatment of peripheral neuropathy. If you feel adventurous or dare, we say desperate, we recommend that you give it a try, as you just might find some relief. Research concludes that acupuncture dramatically improves the effects of diabetes. Patients receiving medications jumping from an approximate 8% neuropathy symptom score success rate to over 90% effective rate when acupuncture was added to the treatment regimen. The neuropathy disability score also showed significant improvement when acupuncture was added to the treatment regimen. The medication-only group had a 37.45% success rate. Acupuncture was added to the treatment regimen, and the neuropathy disability success rate jumped to over 90%. The group receiving both acupuncture and medication simultaneously, however, had over a 95% effective rate. The importance of acupuncture for the treatment of diabetic neuropathy increases as the obesity epidemic worsens in the United States. Approximately 30% of all U.S. children are overweight, and approximately 1/3 of today's youth will contract diabetes. In the U.S., over 26 million people have diabetes. Now, diabetic neuropathy is a type of nerve damage that can occur if you have diabetes. High blood sugar, glucose, can injure nerves throughout your body. Diabetic neuropathy most often damages nerves in your legs and feet. Depending on the affected nerves, symptoms of diabetic neuropathy can range from pain and numbness in your legs and feet to problems with your digestive system, urinary tract, blood vessels, and heart. Some people have mild symptoms, but for others, diabetic neuropathy can be quite painful and disabling. Diabetic neuropathy is a common and serious complication of diabetes, but you can often prevent diabetic neuropathy or slow its progress with tight blood sugar control and a healthy lifestyle. Now, some of the symptoms of peripheral neuropathy are numbness or reduced ability to feel pain or temperature changes, tingling or burning sensation, sharp pains or cramps, increased sensitivity to touch. For some people, even the weight of a bed sheet can be painful. Muscle weakness, loss of reflexes, especially in the ankle, loss of balance and coordination, serious foot problems such as ulcers, infections, and bone and joint pain, a lack of awareness that blood sugar levels are low, hypoglycemia, unawareness, bladder problems including urinary tract infections or urinary retention or incontinence, constipation, uncontrolled diarrhea, or both, slow stomach emptying, causing nausea, vomiting, bloating, and loss of appetite, difficulty swallowing, increased or decreased sweating, problems controlling body temperature, changes in the way your eyes adjust from light or dark, increased heart rate at rest, sharp drops in blood pressure, erectile dysfunction, vaginal dryness, decreased sexual response, severe pain in the hip and thigh or buttock that occurs in a day or more, eventual weak and shrinking thigh muscles, difficulty rising from a sitting position, abdominal swelling in the abdomen is affected, weight loss. There are many more symptoms. You should see a doctor if there's a cut or a sore on your foot that is infected or won't heal, burning, tingling, weakness, or pain in your hands or feet that interfere with daily activities or sleep, changes in digestion, urination, sexual function, dizziness. These signs and symptoms don't always mean you have nerve damage, but they can be a sign of another condition that requires medical care. Early diagnosis and treatment of any health condition gives you the best chance for controlling your diabetes and preventing future problems. Damage to the nerves and blood vessels can occur. The exact cause likely differs for each type of neuropathy. There are many types. Researchers think that over time, uncontrolled high blood sugar damages the nerves and interferes with their ability to send signals, leading to diabetic neuropathy. High blood sugar also weakens the walls of the small blood vessels that supply the nerves with oxygen and nutrients. However, a combination of factors may lead to nerve damage, including inflammation in the nerves, genetic factors, smoking, and alcohol abuse. What are some of the risk factors? Anyone who has diabetes can develop neuropathy, but these risk factors make you more likely to get nerve damage. Poor blood sugar control, diabetes history, kidney disease, being overweight, smoking. What are some of the complications? Loss of a toe, foot, or leg. Nerve damage can make you lose feeling in your feet. Joint damage, urinary tract infections, and urinary incontinence. Hypoglycemia, unawareness. Sharp drops in blood pressure. Digestive problems, sexual dysfunction, increased or decreased sweating. You can prevent or delay diabetic neuropathy and its complications by keeping tight control of your blood sugar and taking good care of your extremities. Blood sugar control. Checking your A1C test twice a year is very important. Foot care. Follow your doctor's recommendations for good foot care. Check your feet every day. Keep your feet clean and dry. Trim your toenails carefully. Wear clean and dry socks. Wear cushioned shoes that fit well. Studies have suggested that acupuncture might help people with diabetes by improving blood sugar levels, relieving the symptoms of neuropathy, a complication of diabetes. It improves blood sugar, glucose management, help with weight loss, protect pancreas function, which is responsible for production. It improves health, adjusts the balance of hormones that affect diabetes, for example, melatonin, insulin, glucocorticoid, and epinephrine. In recent years, scientists have found that acupuncture might impact the biological mechanism of diabetes and prediabetes to become an effective treatment. There are many benefits to acupuncture. A number of studies have indicated that acupuncture may offer benefits for people with diabetes. Glucose and insulin levels are normalized. Lower glucose levels have been witnessed. Increased insulin levels are taking place. Improved glucose tolerance. Insulin sensitivity and resistance is affected. Also, acupuncture and the medication metformin work in harmony together to reduce any symptoms of diabetic neuropathy. Better glucose lowering effects is a result. Greater insulin sensitivity is witnessed. Now remember, it isn't basic acupuncture that's required. It's electro-acupuncture or electro-stimulation acupuncture that's required to take care of diabetic neuropathy.